Welcome to Healthy University, where we'll discuss issues and subjects on how you can live a healthier and more productive life. And now, here's your host for Healthy University, Alan Eisenberg.
Hi, and welcome to another episode of Healthy University. This is Alan Eisenberg, and it's funny, it's been a year since I released my book, my memoir, about the long-term effects that bullying had on me, called A Ladder in the Dark, and I'm lucky enough today to have one of the experts in the field of research who has been studying this and writing about it. I have Dr. Ellen Walser deLara, who's a family therapist and an associate professor at the School of Social Work at Syracuse University. Her areas of research expertise include child maltreatment, bullying from a system theory perspective, adolescent development, and understanding violence over the lifespan. She's the author of 3 books, her newest being Bullying Scars, The Impact on Adult Life and Relationships, published by Oxford University Press. Hi, Ellen. Thanks for being on the show today.
Hi, Alan. I'm very pleased to be here.
Well, I appreciate it. And like I said, it's just uncanny that my book came out about a year ago, and then I had found you and you were sitting doing the research and writing part about what I think I write about. So, I just kind of want to get right to the point because I think we're going to have a lot to talk about as you've studied it and I've lived through it. What do we do? What do we know now about the long-term effects of bullying on people? What have you discovered?
Well, I've discovered quite a number of effects through my own research, and then that of other people also coincide with my research. And there is quite a long list, unfortunately, of the long-term effects of bullying on any number of people. And one is anxiety, and that is either sort of a generalized feeling of anxiety that people carry with them, or a specific type of anxiety called social anxiety, where they have difficulty in circumstances with other people. A second impact is panic disorder. Also, people carry with them a great deal of depression. Low self-esteem seems to be really quite pervasive long-term effect of bullying. People carry also with them feelings of shame. Here, people really ought not to be feeling a sense of shame, because if they were bullied, the shame doesn't belong to them. It belongs to the person who was doing the bullying, but they internalize what's happened, and then they carry feelings of shame with them for a lifetime. People also have difficulties over a very long time, almost throughout lifetimes for many people, difficulties in relationships, both in friendships and in intimate relationships. People may misuse substances in order to deal with all of these feelings.
Yeah.
We see people have developed eating disorders that have carried out throughout their lifespan. Certainly, many people, though not all, develop post-traumatic stress disorder. We see people with self-harming behaviors, then also sadly suicidal thinking and suicidal attempts. There is an increased risk of developing psychosis later in life. And basically, bullying is a public health issue, so that there are general health long-term effects and mental health long-term effects. So in terms of general health, we see that bullying can lead to basic systemic inflammation. We see a 4 times greater risk of diabetes among bullying victims, and a 9-fold increase in heart disease among bullying victims. Further, studies also are demonstrating, and also my own research, that people who were describing themselves primarily as bullies demonstrated greater likelihood of being involved later in life in the criminal justice system.
Right. Yeah.
So these are just the primary long-term effects of bullying.
Yeah, and I think that's an important point. Even your last point there about criminal justice. I think I was reading that something that 60% of them end up with some record, and then 40% of the 60% end up with two things on the record, and that's their life. That's it. Good luck getting a job and living a good life and all of that. So it isn't a one-sided issue, but I also find that for me at least, and for several people I talk to, there's an anger element within us. What I discovered to be displaced aggression, or I had actually coined a term before I knew that one, which was perceived threat syndrome. That everything you saw around you was a threat, or my wife would just make an offhand comment, and I would feel like that was a threat. And not being able to distinguish sort of a dialogue of disagreement to a threat, and taking inappropriate action on that. Did any of that come out in your research as well?
Oh, most definitely. One of the things that I saw very clearly is that people do carry with them a sense of rage that has been oftentimes very long suppressed since childhood bullying, and then when they're in a relationship, it can flare up because, as you pointed out very nicely, sort of anything can be seen as a threat, and then the rage can explode. People are extremely defensive, trying to protect themselves from what they perceive as any kind of incursion against them, as they experienced when they were a child. So that kind of reaction, at some level, makes sense in quotation marks, because the person is trying to protect himself. Of course, it's not very helpful in an intimate relationship or even in a friendship, but it makes a certain level of sense. What I also found, though, is that people sometimes will go beyond that sort of level of defensiveness, and the rage boils over into physical violence in the relationship for some people, which of course then is extremely destructive.
And I think that comes into play because, at least from a male perspective, but you see it a lot more on the female side of bullying these days, is that idea that, at least in my world when I was little, that physical violence seemed to be the only solution that worked. So you almost learn this behavior that you can't, talk your way out of a bully's getting to you, or at least, what I find with people like myself, and I classify myself under the highly sensitive person side of why I was bullied, is, I don't want to hurt someone else. I don't want to do these things. So, every punch I threw, everything I did that I felt forced to do was another level of pain. But then I learned, you learn this bad habit of believing that, by throwing the punch, you're solving the problem, because that bully now usually won't bully you. But then the next one's just right around the corner. And then, as I always like to tell people, there's a little thing as we become adults called assault. And so it's not something we should be necessarily teaching. And when I speak, I talk to lots of people, and the first thing out of a lot of dads' mouths is, I tell my kid to fight back. And I'm like, one time I had a juvenile judge in the room, and she stood up for me and was like, no, that isn't what you need to do. That's assault. And I think it's just something we've learned. Luckily I've never been a violent person, but there were certainly times where I can remember just getting very upset, and part of it is the anxiety part, right? So you're dealing with feeling anxious a lot along with feeling threatened. That's a bad combination.
Well, it is, and you describe it perfectly. And the issue is that we really need to help kids figure out what kind of response does work, what kind of response does make sense. And when I was studying adolescents before I did this research on adults, when I was studying adolescents and their responses to bullying, what I found was the kids who were most successful in dealing with bullying would be those who would be classified as having high social emotional intelligence. So they would say such things as, well, when someone bullied me, I just walked away and said, oh, whatever. And I thought to myself, well, this person doesn't know who I am. This person is going nowhere in life. For him, this is high school or middle school is all they've got to look back on. So you could hear that they had these really highly mature ways of thinking about what was happening. And so they either had come up with that on their own accord, or they'd had somebody to talk to, a parent or perhaps somebody at school, who was helping them think that way.
Yeah.
So they were able to put all of this into a sort of category and walk away. Now, that being said, that doesn't mean they didn't carry pain in their heart.
Yeah. And I think that, there's a term I had heard of that, some kids are just natural negotiators, and we see, people pick different careers as they get older, right? And the ones that probably were the natural negotiators, right? They can do that kind of stuff. They can, either let things roll off their shoulders or not carry the weight, or not really, kind of have a sympathetic, like, well, that person's got issues, so I'm not going to bother. Versus someone like me who's just going to be sensitive to anything anybody's doing around them. And both, I like to say, everything has a good and bad, right? So, and then there's the idea that, I shouldn't have to change who I am, or, people who have disabilities are picked on, or have levels of autism. Like, I've known several people who would have been classified back in the day as Asperger's, but now are autism spectrum low, that are picked on because they're not doing things right. They really don't have that ability. They don't have that ability to understand, or I didn't really have the ability to think about anything more than, this painful feeling I was having of being treated this way. And I wasn't able to let that go. That just was not something that I was, being the personality type that I was and still am, be able to do that, So it's like I'm the guy that's out here talking about it as an adult, whereas a lot of people have either buried it or found a way to let it go. But I still think I see a lot of adults walking around, and I know a lot of adults who walk around with, the scars of youth still on them.
Yes, I agree with you completely on all points there that you just summarized. One is that most kids don't know how to think about what's happened,
right.
And then so they need help in thinking about it. And then, secondly, that most adults are walking around with experiences that they've had from childhood. And when I ask people, tell me about a time that you were involved with bullying as either a bully victim or a bystander, people can tell me immediately. It doesn't matter if they're 18 or 68.
Oh, yeah.
I can tell you immediately. And I'll say, well, can you tell me some adjectives that you would use to describe your experience? And they can tell you adjectives immediately. So that it leaves long-term scars, which is why I wanted to write this book on bullying scars.
Well, we have to take a quick break, and then I'd like to hear more about the scars, but I'd like to tell you something I do when I speak. I think you'll be really interested in how I kind of dig around that same area that you were just talking about. But we'll take a quick break, and then we'll be back with Dr. Ellen on Healthy University. Be right back.
You're listening to Healthy University with Alan Eisenberg. Bullying is in the headlines every day. Now, there's a website to provide you information, blogs, podcasts, research, and links to learn more about how bullying can have long-term effects to the survivors and the bullies. Visit bullyingrecovery.org and learn more about how you can help yourself and others. Book our team for your anti-bullying events. Everyone deserves to live the life they want and overcome the past. bullyingrecovery.org, helping people learn to thrive after bullying trauma.
Hi, and welcome back to Healthy University. This is your host, Alan Eisenberg, and I'm here with Dr. Ellen, and we're talking about the long-term effects that bullying have. And right before the break, Ellen, you were talking about a technique that you used or something when you talk to people, and there's something I do in my presentations that I picked up on, I think, which is very similar. And what I tend to do is I like to play the game, so I'll have an audience of people. That doesn't necessarily mean that they felt like they were bullying victims or dealing with that. And I say, okay, well, let's go back to your, usually I try to bring them back to elementary, middle school. I said, where you either dealt with a bully or somebody, who you didn't like or whatever. Can you give me their first and last name? And I said, don't say it out loud, but do you know it? And, these are adults, so it's not like this is recent. And they're like, yeah. I said, okay, do you know your best friend's first and last name? And they're like, yeah. I said, okay, what was the name of your teacher? I get a blank stare. And some people can come up with it, particularly if the teacher was a mentor. But most people can't do it. And I said, that's because that stuff is sitting right in the back of your head, and that's how easy it is to come forward because it was that important a moment. Those people made such that impact on your life, both good and bad. So you remember both of them. But the people that really didn't make that impact, you don't hold on to, because we've known thousands of people throughout our lives. And so to think about a first and last name and remember it like that, without having to think, 30 years later, 40 years later, 50 years later, I find to be pretty amazing. And telling that, they are living with this information. It does affect who they are.
Well, yes. You're 100% right. It shows how critically important these kinds of experiences or these kinds of personal relationships are on our personal development. So, what we know about friendship is that friends, people who have your back in school, can sustain you, can help you from being victims of bullying or other kinds of maltreatment. And we also know that, unfortunately, if you are the victim of bullying or a bully, that also affects your development, both physical and social and emotional, and can do so throughout your life. So, yes, these kinds of experiences and personal interactions have huge impact on our developing self.
And what did you discover when you were doing your book research that was different? Did anything surprise you or come out like, I know you were writing about bullying scars and as you go into your research, but was there anything that was like a wow factor for you as you were talking to people and doing your research?
Yes, in fact, I was really surprised to learn that, I asked people, Was there anything that was positive for you about being bullied? The reason I asked that question was because when I interviewed adolescents, I had the chance to interview over 1,200 adolescents, and they just said no, bullying is terrible. There's nothing positive about it. But when I interviewed adults for this research study, I interviewed over 800 adults, and about 40%, a little bit more, said yes to that question. They found that they had a positive impact, unexpected outcome from the bullying they experienced. And so that was a wow factor for me. And what people talked about is that they decided several things. One was a conscious decision to do something positive with their life. That and told so many times that they were nobody, they were a loser, etc., that they decided to be somebody. And whether that was be somebody in terms of you're going to know my name, which people said straight out, well, I decided people are going to know who I am, to I'm going to be somebody who makes a difference in other people's lives. So there were other kinds of positive outcomes for people, such as they made a conscious decision not to treat other people as badly as they'd been treated. So what I would call that was a sort of enhanced moral development.
Yeah.
And they said that they, as a result of the bullying, they found their own inner strengths that they hadn't realized that they had, and had a sense of personal pride that they were able to overcome what happened to them. And so basically, you see then a basic sense of resiliency and what is called post-traumatic growth.
Right. And maybe I'm one of the poster children of that, doing what I'm doing.
Yeah.
Because that was a decision. I mean, later in my life, obviously, I had to go through several personal journeys first, and I think that's a part of what we're talking about as well in terms of the mental illness part. I always say I wanted to write this book, this memoir. I always wanted to tell people. I had told my parents, my whole life that this bullying that happened to me in this very short, 7-year period of my youth, was affecting me. I knew it. I have a pretty good, again, being HSP, pretty good self-awareness, and I know when I don't know why, but I felt like it was affecting me. And then as I got older, at some point, as I said, sort of, when I hit 40. I was like, I'm going to write about this, as a media person that I am, career-wise. I'm gonna make this my thing I blog about, and then that just out of nowhere that went from 0 to 2.4 million readers and used in schools, and I said maybe I'm onto something, and then the news was all over it, the subject. And luckily, I think for you and I who are trying to do good in this area, it has a lot of attention now, finally, and people I think are starting to believe. I think it took a while, but post Columbine, that something's going on here, and it's not just kids being bullied. So I feel like that's at the end of the day, once I went through what I say is the third part of my book, the recovery. Even though I started before I was recovered, I knew that was the journey I wanted to go on, and that I wanted to bring to others. Is that this does happen, and it does cause these effects, and we need to do something about it. And we can't just as an adult, you can't just pretend like it's not happening, which is I think what I feel like a lot of adults end up doing is, a lot of them won't tell their personal stories so easily. And then, how many don't tell their kids, when their kid comes home and says, I was bullied, how many adults don't tell their children, yeah, so was I, and here's what happened to me. And I always think that's what I was trying to do, is to be the so was I guy. so that people wouldn't feel alone. Because again, as you hit on from the mental illness side of the fence, at the end is depression, and that's when it gets very dangerous, right? That's when, particularly for youth, who really look at short time spans and don't have sort of, here I am, a father of two and a husband, I have commitments. When you're a youth and you don't feel like you have those commitments, you can make a very rash decision about your life pretty quickly.
Well, all of these things are very true, and you obviously have a positive result from what you experienced, but you have that based on a lot of hard work.
Yeah.
And I think that's a really important message to people, that there is a lot of hard work that needs to go into successful recovery from, bullying victimization. And the other thing that you said that I really resonated with is that you want to let people know that they're not alone. And the people that were part of my study said that over and over and over again, that they were very happy to participate in the study because they want other people to know that they're not alone, that this has happened for, so many people. In fact, I think that it happens so often and in so many venues that the very first thing that you need to do if you're a survivor, a bystander, a bully, anybody, is you need to acknowledge that this happened to you and that it has some sort of impact on who you are today. Even if you don't think about it anymore, you don't let it be conscious anymore, it still has an impact on you in some form or another today.
And that's just the reality. And I think as people talk about it, again, it's never my intention to make people recall things that they're suppressing necessarily, but at the same time, we're outwardly behaving what I think we've inwardly created, and that's why I do sort of that funny test, or you do your things where I'm just making people realize it's not that buried, it's not that far gone from them. And I think that's important. And then I also totally agree. It's just a conversation piece. We can't just pretend like it's not and keep silent, because I know people, being one of the people, and you probably do too, who haven't left their house in years. They have not left their house in years. And that, the social anxiety level is so high. They're so afraid of what could happen if that they would be attacked and these things. And it's terribly painful to watch. And I know, for you who works in the social work field and sees probably more of it, you want to, of course, tell people they can get better and that they can do this work. But, I admittedly had to make a 180 on my whole life. And that was tough. That was hard, not just sort of other things you were saying, not just mentally, but physically, eat differently, try to, stay calmer, physically and I'm just getting over like my first cold in 3 years. So that's how I feel like I've been so much healthier than before, whereas before I was always complaining. I never felt good. My stomach always hurt. And that was because my fight or flight, my sympathetic nerve was just grabbing onto my stomach and clutching nonstop. And then I finally learned that's what it was doing. And, so there's all these effects, and people just need to know that, a lot of these things, they may not be feeling well. They may, but all of these things could be mental scars and physical scars that we have. That we carry. So what do you think, what would you say would be like the most important health habit a survivor should get started with? What would be, the biggest, and obviously professional help to me is something that people should know is not a stigma. It's something that a lot of people work with.
Well, that's a really great question. I think that we, as general public, need to encourage open dialogue about this topic, which obviously you're doing in a very big way, and which I'm also trying to contribute to by my books and by various appearances that I make, because otherwise not talking about it is not acknowledging it, and it's sort of similar to when people were sexually abused, and that was underground for so many years that nobody talked about it, no one acknowledged it, and people just continued to suffer in silence. So I think that's the very first thing that has to happen. But I also think that many survivors of bullying need to seek professional help to deal with the symptoms that are left over from the deep scars that are left by this particular form of child maltreatment, because most survivors still have a powerful form of negative and destructive self-talk.
Mm-hmm.
So, in other words, you were told negative things about yourself that many people eventually begin to believe to explain why they were treated so badly. So people will start to say to themselves, there must be something wrong with me.
Right.
And so as a result of that, then professional help really is very useful to deal with that type of trauma. And people who have specific training in cognitive behavioral therapy or trauma-based therapies, cognitive behavioral trauma-based therapy, or mindfulness-based practices are useful to anybody on the spectrum. And I say it that way because my experience is that there's oftentimes, very often, bully-victim-bully cycle.
Mm-hmm.
So that, people, and you talked about it in your book very nicely, because when you contacted your bully, he was able to tell you that he didn't come from a very good home environment, and it sounded like he had been mistreated there. So oftentimes we see that people who are bullies have been victimized first, and then they turn around and bully others. And so there's a cycle that gets built in for someone's behavior. And so in order to break that cycle, people have to be able to take a look at all aspects of, what happened for them. Yeah. And they can do that with a mental health professional.
Yeah, and I think, nobody should be scared. There's, you mentioned even mindfulness. There's many, many mental health professionals in today's world, and, people should do their research. Everyone gets to choose, and that's the one thing, but you need to make a choice. I always tell people, I'm never here to tell you what, way to go. Some people want pills, some people want therapy, some people want life coaching, some people want, so maybe something in more of the social work realm. There's a lot of different work being done out there. And the thing is, people need to, unfortunately, at your worst time, you need to do your homework and
exactly.
Figure out, don't go with the first person if that's not comfortable, because empathy plays a big role in this whole thing as well, I think. And, some therapists are going to be able to be empathetic and some aren't. Some don't kind of understand that area as well. So, you can find the right people. I mean, they're out there, and, I think part of it is, the hardest part is being patient and realizing, this is work. It's not going to, tomorrow you're not going to feel better if somebody gives you this pill or, tells you to do this or it's going to be a little at a time, and eventually, and people always ask me, well, are you all better now? I'm like, no. I'm not all better. I'm working on it every day, and it's always 2 steps forward and 1 step back, and I have no need for perfection in my life anymore. And I took on mindfulness. That's become my sort of habit now. That is, to me, the most important thing that I've learned how to do, because I never would have pictured myself doing that or focused on that. And it's a very, it's not very complex, but people are afraid of, it forces you to face yourself and challenge yourself. And I think that's the part that once you can get past things, then you can start to do that so much easier. So
that's exactly right. And I liked also what you said about, find somebody who is qualified and find someone with whom you feel comfortable and who is empathic, because there's really no way to sort of exorcise these demons without having somebody, if you're going to talk to somebody who is empathic. And then in terms of appropriate training, I also feel like it's important to state that many people are bullied first in their own homes.
Mm-hmm.
And so if that's the case, then what they need is, along with maybe some of these other kinds of trainings, is somebody who is trained as a family therapist.
Yes.
So somebody will understand what's happened to them, and then that person who's well-trained as a family therapist won't re-victimize the person,
right?
Which would be terrible.
Right. And yeah, I think that's very true, that, it's not always just you. Sometimes you've got to look at the bigger familial issue and deal with that. I know lots of people that don't talk to their parents or don't talk to their families, and most of the time I don't know what's happened, but something's happened that's very dark in their mind. Well, I hate to say it, we're just about out of time, but I want to give you a chance to talk about how people can get in touch with your books and your information, so they can get even further help along the way.
All right. Well, I appreciate that. My books are available at any major outlets. Barnes & Noble. They're on Amazon, so people can go to Amazon and Google my name, Ellen deLara, and put my name in there, and will pop my books. So my most recent book is Bullying Scars, The Impact on Adult Life and Relationships. It also talks about what happens for children and does give some prescriptions for helping both children and adults. So I want to acknowledge that. And, I am at the School of Social Work at Syracuse University, so people can reach me there.
Wonderful. Yeah, and thank you for all you're doing. It was an amazing conversation. Of course, could have been a much longer show. So maybe we'll get a chance to talk again. But I thank you for coming on the show and doing the work you're doing. And really, I wish you the best of luck in continuing to fight the good fight as we're doing, to let people know that, bullying is not something that just happens to kids or just happens and you move on. There's more to it. So thank you, Dr. deLara, and thank you for being a guest today.
Well, thank you very much, Alan, and thank you for the opportunity and for your good work as well.
Thank you. And this is Alan Eisenberg with Healthy University. I hope you'll join us next time.
Thank you for listening to Healthy University, brought to you by Bullying Recovery, LLC. This podcast does not replace the need for medical advice, professional diagnosis, opinion, treatment, or services to you or any other individual. The information provided here or through linkages to other sites is not a substitute for medical or professional care, and you should not use the information in place of a visit, call, consultation, or the advice of your physician or other healthcare provider. Join us next time for more Healthy University.